That final swish of mouthwash in the morning, it feels so fresh, so clean, so finished. It's a habit for millions of us. But what if I told you that for many, this daily ritual is little more than rinsing money down the drain? And in some cases, it might even be working against your oral health. Over the next hour, we will not just ask if mouthwash is a waste of money. We will uncover the 3 specific situations where it is absolutely essential. We will show you precisely what the science says you should be using instead. You deserve clear facts about what touches your body. We will dissect the history, confront the 3 biggest myths, and reveal the common ingredients that might be making your mouth drier and your teeth softer. Stick with us, because by the time we finish, you will know exactly when to buy that bottle and when to leave it on the shelf. This knowledge could save you significant money and prevent unnecessary dental discomfort for years ahead. Before modern mouthwash stocked our bathroom shelves, what was the biggest public concern? It wasn't cavities or plaque, it was simply odor. Our story does not start in a dentist's office. It begins in the late 1800s with a powerful antiseptic. This compound was created to clean medical tools and sterilize surgical sites. It used alcohol and strong chemicals. It was purely a disinfectant. Initially, manufacturers marketed it for industrial use and sometimes as a harsh cleaner. It was never designed for everyday oral hygiene. Then everything changed. A savvy marketing team identified a huge untapped need. People were deeply self-conscious about their breath, but too polite to speak about it. The marketers solved this by inventing a clinical-sounding term, halitosis. They turned common breath into a serious, embarrassing medical condition. Their product became the necessary cure. They promised this strong rinse would annihilate the germs responsible for the smell. It transformed the product from a general disinfectant into an essential tool for social confidence. It became a phenomenon. Today, companies built on this premise still sell millions of gallons of rinse every year. They still use aggressive language. They still promise to kill 99.9% of germs. But does a deep cleaning, germ-killing rinse truly lead to superior dental health for everyone? The evidence suggests a far more nuanced answer. For most of us, mouthwash offers very little added benefit. Why? Because the foundation of oral health is simple mechanical cleaning. If you brush for 2 minutes twice daily and clean between your teeth consistently, you have already removed the vast majority of problematic bacteria and plaque. For the average healthy adult, mouthwash primarily delivers a temporary fresh sensation. To truly understand why you can skip that daily swish, we must dismantle the 3 most persuasive myths the industry relies on. Stopping these beliefs will stop the wasteful spending immediately. The first big myth: mouthwash cures bad breath. When odor becomes a chronic problem, it signals a structural issue. That smell comes from bacteria and food debris, often trapped deep within the folds of the tongue or hiding under the gums. When you introduce a powerful blast of mint, you are simply overwhelming the odor temporarily. You are not eliminating the source. Consider this: if your bathroom drain smells foul, do you just spray air freshener into the drain opening? No, you use a snake or a cleaner to remove the clog deep within the pipe. Mouthwash acts like the air freshener. If you rely on it, you allow the underlying issue, gum disease, trapped food particles, or bacteria on the back of the tongue, to worsen undetected. What if the odor isn't even coming from the mouth? Chronic halitosis can sometimes stem from the stomach, tonsil stones, or sinus issues like postnasal drip. Rinsing cannot reach these sources. Your immediate cost-free takeaway here is powerful. If odor is a concern, spend 10 additional seconds brushing your tongue thoroughly. If the odor persists, consult your dentist or doctor. Do not spend $120 a year on temporary masking agents. The second myth is perhaps the most dangerous one, the belief that rinsing can replace flossing. If you are someone who thinks, I swish vigorously so my teeth are clean enough, you are putting yourself at serious risk. Why does liquid fail where floss succeeds? Plaque, the film that destroys enamel and irritates gums, does not float freely in your saliva. It is a sticky bacterial matrix that adheres powerfully to the tooth surface. More critically, plaque congregates in the tight spaces shielded by the neighboring tooth and protected beneath the gum line. No matter how aggressively you swish a liquid, its hydrostatic pressure is not strong enough to disrupt this adhesive film deep inside those crevices. Imagine your teeth are close-set fence posts. Mouthwash can clean the front surfaces of the posts. Only a physical scrub, floss, soft picks, or a water jet can get into the tiny gap and scrape the invisible film away. Plaque left undisturbed hardens into rock-like tartar. Tartar is abrasive, constantly irritating the gum tissue. This leads directly to gingivitis and eventually periodontitis. For older adults, periodontitis remains the primary driver of tooth loss. Can you afford to skip the most effective step? Studies consistently confirm that mechanical cleaning between teeth is essential for long-term health and retention. So, when time is short, never trade your interdental cleaning for a rinse. That physical cleaning is non-negotiable. It is the real defense against the invisible decay that starts between your teeth. Now, let us tackle the third and most deceptive myth. Why is killing 99.9% of germs actually a bad strategy? That powerful statistic sounds impressive, but it misunderstands your body's complex biology. Your mouth is a vibrant ecosystem. It hosts trillions of microorganisms, your oral microbiome. Just like the healthy bacteria in your gut aid digestion, the bacteria in your mouth are critical. They help regulate pH balance. They occupy space, preventing more dangerous, disease-causing bacteria from taking over. When you use a harsh antiseptic rinse, you are not a skilled surgeon. You are using a broad-spectrum killer. You wipe out the good, helpful bacteria alongside the bad ones. What is the consequence? You have created a vacuum. Nature abhors a vacuum. The few remaining bacteria, often the toughest strains that survived the assault, quickly repopulate the environment. If the balance is tipped, the pathogenic strains can multiply rapidly without the natural resistance from the good guys. This broad kill approach can destabilize your oral environment, potentially making you more vulnerable over time. Beyond the microbiome, a major invisible danger lurks in many popular mouthwashes, the alcohol. Many classic, highly flavored formulas contain high percentages of alcohol, sometimes over 20%. This alcohol acts as a potent drying agent. For adults over 55, this is a serious and immediate health risk. Why is this demographic so sensitive? Many of us take medications for chronic pain, high blood pressure, or depression that already suppress saliva flow. This is called medication-induced dry mouth, or xerostomia. If you combine medication-induced dry mouth with an alcohol-based mouthwash, you accelerate the problem dramatically. Why does losing saliva create such a risk? Saliva is your mouth's natural superhero. It constantly neutralizes the acids produced by bacteria after you eat. It washes away particles. Crucially, saliva contains minerals that actively repair tiny, non-visible spots of tooth decay. When saliva flow is restricted, you lose these essential defenses. When the mouth stays dry, cavities can form at a terrifying speed, often attacking the roots of the teeth, which are less protected than the enamel crown. This is why aggressive antiseptic mouthwash is often counterproductive for daily use. If you are using a harsh, tingling, alcohol-based rinse daily, check the label right now. If alcohol is listed high among the ingredients, consider switching immediately. Protecting your natural ability to produce saliva is vital. This is not about being clean, it is about survival. If these simple, evidence-based revelations help you rethink your daily routine, please subscribe to Silver Smile and Bites. We commit to delivering only the clear, science-backed truth for improving your health and vitality. So, we have established that if you maintain a healthy mouth with brushing and flossing, daily mouthwash is unnecessary and carries genuine risks. However, we promise to show you the 3 situations where mouthwash shifts from a cosmetic extra to a crucial, essential treatment. When used correctly and under advice, mouthwash can be a powerful medical necessity. The first essential use is for short-term acute healing and infection control. Have you just endured wisdom tooth removal? Did you have complex periodontal scaling? When your gums or tissues are physically traumatized, the immediate goal is to prevent infection in the open wound while minimizing irritation to the healing site. In these specific scenarios, your dentist will prescribe a powerful rinse. The active agent is usually chlorhexidine. This chemical is highly effective at reducing the bacterial load, but it is potent. It is medicine. It is not for maintenance. Chlorhexidine can cause temporary staining of the teeth and disrupt the microbiome severely if used too long. Follow the instructions precisely. Use it for the prescribed few days or 2 weeks and then stop. This application is a rapid defense system to guide you past the critical healing stage safely. The second essential use involves managing moderate to severe gum disease. We are talking about periodontitis, where the gums are chronically infected, often receding, and show bone loss. When you undergo deep cleaning, scaling, and root planing, your dental team is manually removing tartar and bacteria from the root surfaces. After this treatment, they may recommend a therapeutic rinse as a supportive measure. This rinse will often contain cetylpyridinium chloride, or CPC. CPC is proven effective at fighting plaque and inflammation without the extreme harshness of chlorhexidine. It helps maintain the reduced bacterial load between your hygiene visits. This specific rinse is part of an ongoing treatment plan for a specific disease. It aids the deeper mechanical work performed by your hygienist. If you have been diagnosed with advanced gum disease, adding the right therapeutic rinse based on professional recommendation can significantly slow the progression of the disease and help preserve your existing teeth. Do you know the state of your gums? If not, ask your dental team. Never let a severe infection go untreated, masked only by temporary minty freshness. The third and arguably most important use case for our audience relates directly back to chronic dry mouth, or xerostomia. We already covered why low saliva flow is a dental catastrophe waiting to happen. If your prescription medications or an underlying medical condition have severely reduced your saliva, you must actively supplement that natural protection. For this issue, a specialized class of mouthwashes become essential. These are not focused on germ killing. Their goal is lubrication and moisture retention. You must look for rinses that contain ingredients like xylitol, glycerin, or specific enzymes engineered to mimic the properties of natural saliva. If you battle dry mouth, using these lubricating rinses several times throughout the day, especially before bed, is a critical defense strategy. They soothe irritated tissues and create a protective barrier against acid erosion. In this case, money spent on the right rinse is not a waste, it is an investment in preventing rapid, costly decay. The key is to avoid high alcohol rinses entirely. They are your enemy. Seek out the soothing, clear, lubricating formulas specifically marketed for dry mouth relief. So, to recap the 3 situations: trauma/surgery, severe gum disease, or chronic dry mouth. If you do not fall into one of these categories, you can confidently stop buying general mouthwash today. But what if you still want that extra step? What about the average person who wants defense against decay and a fresh feeling safely? This leads us to the smart, simple, and often free alternatives that deliver real, measurable benefits. If your primary concern is cavity prevention, the most robust defense remains fluoride. Fluoride literally strengthens the surface of your teeth, making them tough against acid attack. Most effective toothpastes contain it, but sometimes an extra boost is necessary. If your dentist flags you as cavity-prone, they may recommend a daily fluoride rinse. These are usually alcohol-free and simply deliver a higher fluoride concentration, but remember the critical rule of timing. When you brush with fluoridated toothpaste, you are depositing a highly concentrated layer of protection onto your teeth. If you immediately swish vigorously with water or another rinse, you wash away that layer. You neutralize your own efforts. If you choose to use a fluoride rinse for prevention, timing is key. Do it at a completely separate time from brushing. Many experts recommend using the fluoride rinse midday or ideally right before bed. Why before bed? This allows the fluoride to sit undisturbed on your teeth for hours while you sleep. The simple protocol is spit the toothpaste out thoroughly, but do not rinse with water. Give the residue time to absorb. If you use a rinse, use that targeted fluoride product later on. Now, let us discuss the ultimate low-cost, high-impact alternative, the saltwater rinse. You may remember this from your grandmother, and it remains a time-tested, evidence-backed staple. Saltwater rinses do not aggressively kill bacteria. Instead, they create an osmotic pressure that can draw fluid out of inflamed tissues. This effect is fantastic for reducing swelling and promoting faster healing of canker sores, small cuts, or generalized gum irritation. It acts as a gentle, non-toxic cleansing agent that respects your natural mouth balance. The key is preparation. You do not need a harsh burn. You need a soothing saline solution. Mix just half a teaspoon of plain table salt, nothing fancy, into 1 cup of warm water. Swish that solution gently for about 30 seconds and spit. You can do this several times a day when your gums feel tender or if you have a mouth sore. It is a powerful, budget-friendly remedy that uses simple physics to aid your body's natural healing process. Compare this to the high-cost natural mouthwashes featuring essential oils. While oils like tea tree or eucalyptus have some antimicrobial properties, they often lack sufficient scientific evidence to justify their high cost for daily use. If not diluted properly, they can sometimes cause irritation. Why pay a premium for flavor when a simple salt solution delivers clinically proven benefits for pennies? Beyond rinses, we must always return to technique, especially as we age. For truly optimal health, you need to master your brushing and interdental cleaning methods. When brushing, always use a soft bristle brush. The misconception that you need a stiff brush to scrub away plaque leads to significant problems. Aggressive scrubbing, especially in older adults, rapidly erodes gum tissue, leading to recession and exposed, vulnerable root surfaces. Use gentle, small circles. If manual brushing is difficult, invest in a high-quality motorized brush. These brushes are designed to use light pressure while achieving superior plaque removal. Focus the bristles where the tooth meets the gum. This is where plaque hides and damage begins. And for interdental cleaning, do not let limited dexterity be an excuse to skip it. String floss can be awkward with arthritis. Instead, investigate alternatives. Soft rubber interdental picks are easy to grip and maneuver. Or consider the water flosser. A water flosser uses a targeted jet of water to clean between teeth. It is proven highly effective at disrupting plaque and flushing debris, and it requires far less fine motor skill than traditional floss. Consistency with the right tool is the secret to lasting oral health. We have covered the shocking history, debunked the most pervasive myths, and identified the 3 essential uses for mouthwash. Now, let us create your personal action plan to stop the waste and start the smart approach. If you own a bottle of mouthwash that contains alcohol and is not a prescription or a dry mouth rinse, take it off the shelf. Unless you have a specific diagnosed reason to use it, you are officially cutting that expense and risk from your routine. If you take daily medication, review the side effects once more. If dry mouth is a factor, your immediate focus must shift. Prioritize finding that lubricating, non-alcohol, enzyme-based rinse. That choice is necessary and preventative. It protects your tooth structure against acid erosion far better than any antiseptic rinse ever could. If your only goal is enhanced freshness, switch to an alcohol-free rinse that uses safer alternatives like CPC or xylitol, or simply use a saltwater rinse. You get the desired sensation without the dangerous drying effect. A common psychological hurdle we hear is, the tingling burn is the only way I know it's working. That intense tingling is typically the alcohol or harsh oils. It is a strong sensation, which your brain registers as effective cleaning. But that feeling is not proportional to the actual health benefit. Embrace a routine that is gentle, effective, and evidence-based, even if it does not burn. Think of your oral care budget clearly. Brushing and interdental cleaning are the essential high-return investments. Mouthwash is a specialist tool, necessary only for specific repairs or severe maintenance issues like dry mouth. Don't spend money on a tool you don't need, especially if it carries side effects. We have moved past the outdated marketing and landed on simple, scientific truths for better health. You are now equipped to make informed choices, not emotional ones. Take a look at your dental care routine right now. Are you sacrificing the 2 minutes of flossing for 30 seconds of swishing? That must change today. Are you counteracting your fluoridated toothpaste with a large immediate rinse? Adjust the timing. We believe that improving your vitality after 55 should be simple, clear, and actionable. If this comprehensive guide helped you cut through the confusion and clutter surrounding mouthwash, please hit the like button. Liking this video helps us understand what information is most valuable to you. And if you know someone still stuck in the germ-killing mindset, share this video. You could be saving their oral health and their budget. Remember your critical decision tree. Are you healing from surgery? Are you fighting serious gum disease? Are you struggling with chronic dry mouth? If you answer yes to any of these, use a specific, targeted mouthwash under guidance. If the answer is no, stick to the non-negotiable foundations: gentle brushing, consistent interdental cleaning, and trusting your body's natural defenses. You now possess the complete knowledge. You are no longer influenced by slick marketing or outdated notions. You are the definitive expert on your mouth health. Take control and empower your silver smile today.